Adapting it to a US audience has been really fun and really exciting. And I think that the final product is beautiful. They're to the point, they're very clinical, very practical modules that we really are proud of.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
What's up, everyone? Normally I'd have my partner, Dr. Hadar, with me, but now it's going to be me what's-upping it to all of you. I'm pretty excited about the podcast today. Today, we are traveling to two different continents between France and the North American continent because we're talking about this new eczema program that was developed as a combined effort. And I should say Professor Stalder, who is at the University of Nantes, and he helped to really spearhead this Eczema Foundation program that's called the POP Eczema program that's really looking at educating people around eczema. So I'd like to introduce both of our guests today, and I'm very excited to talk to both of you. First, we have Professor Stalder, who is at the University of Nantes, as I mentioned, in France. And we also have Dr. Peter Leo, who is a well-known guest to all of us and a dermatologist extraordinaire here as well, integrative dermatologist. So welcome to the both of you to the podcast.
Thank you.
Thank you.
Well, let's start with you, Professor. Can you tell us a little bit about this patient optimization program training that has been developed? Can you tell us about when the program was first created? And can you just introduce the program to us a bit?
Yeah, sure. As everybody knows, atopic dermatitis is the most common chronic skin disease in children and also in adults worldwide. And despite effective treatment and broad consensus among doctors, the management of this disease is difficult. The disease is both underestimated, poorly managed by doctors, and ultimately insufficiently treated by the patients themselves. And finally, the patient satisfaction is low. So how to explain this poor patient satisfaction in AD? There are many reasons. First, during atopic dermatitis, patients are their own therapists and must acquire knowledge and skills to apply the right local treatment at the right place at the right time. Moreover, a common complaint among AD patients is that the time allocated to standard consultation does not allow to truly understand the answer to the patient's questions. And when the patient returns home, the practical application of care procedures can be daunting for them. Finally, the mass of information given by caregivers, widely disseminated by social media, confuse the patient, promote anxiety, and increase the burden of this chronic debilitating dermatosis.
You know, I think your point is so well taken. I mean, we educate our patients on what to do with atopic dermatitis, or, we give them all this great tools when we see them. But then, you really are left with, well, how can we further empower them when they're at home, and how can we not have them feel that anxiety? So this is such a nice program. And then, it'd be really nice to learn a little bit more about you, Professor. So can you give us a little background about yourself and what got you so interested in developing this program and your interest in atopic dermatitis?
I'm a pediatrician first, and I was a professor of dermatology. I obtained my degrees, and finally I used a lot of time to try to explain and to convince patients to treat themselves, because the main problem during the communication between patients and doctors is patients would follow the watch. The lack of time is everywhere. And finally, the patients are frequently disappointed. So it's the reason why we organized, and maybe 20 years ago, we organized a survey in my department. And we explore the reason why the patients were so disappointed and the treatment was so badly applied. So the reason why it was the beginning. And after that, we try to modify some things. Our colleague from Germany, Uwe Gieler especially, was my mentor. And he came to Nantes and we decided all together to create the first atopy school in France.
Wow, you have a whole atopy school in France. I mean, looks like you've really pushed this forward, and it's quite inspiring to hear, how you've taken this. And then, Peter, I guess this was developed in France, and now you've created a collaboration where you're bringing the project to the US. What are some of the reasons that you thought this would be a good idea to bring this into the US? And are there any differences between the approaches in France versus here?
Yes. I mean, it's been such an interesting journey for me because my understanding of not only the condition and how to treat it, but also just that interaction with patients and families and the ability to make an atopy school or an eczema school. Professor Stalder really built this concept. And now you see this quite prevalently throughout many places in Europe and around the world. But in the US, we've really lagged behind this. So we have a problem, of course. I think it's twofold. Number one, we have tremendous pressure on our healthcare system to see patients quickly because of the way that we bill. And then number two, we don't have the sort of natural way to release some of this pressure by having something that can happen off hours or with other allied health professionals. So I've tried to recapitulate that a little bit. Right now, it's sort of every other month where we do on a Saturday afternoon, we have a virtual meeting to do education for patients and families. And then we also kind of marry that to a support group. So I really have to thank Professor Stalder for this inspiration and learning about how to do this. And I've tried to bring some of that to my own experience. But the other problem is that we work with a lot of different stakeholders when we take care of a patient with eczema. We often think it's we're in the room with the patient. So that's the whole thing. But we know that's neither the beginning nor the end. And one of the stories I often tell is that the pharmacists play a huge role in this. I'll have a long visit with a patient and a family. And sometimes, I'm 25 minutes late for the next patient. There's beads of sweat on my upper lip. We've gone over all this stuff. We've answered all these questions. I said, okay, you guys are going to do great. I'll see you guys in 4 weeks and we'll talk, And then the next morning I get a call and the mom says, we are very concerned. I said, what do you mean? Well, we went to pick up the medicine you prescribed last night, and the pharmacist said to us, oh, I wouldn't put that on my baby's face. That's not for the baby's face. And in that one little movement, the whole plan shatters, right? The house of cards falls. And I said, well, what should we do? What did the pharmacist tell you to do then? Because that's where the baby's eczema is. And that's what we were talking about yesterday. But it's so powerful. So the idea is, can we bring in some of the other healthcare practitioners who play a hugely important role and have a huge position of trust with the public, with our patients and their families, but often don't get the same educational opportunities for the very clinical aspects of disease, right? Pharmacy education is great, but they're not really always involved in the same level of discussion about the current state of the art for atopic dermatitis and why we're making some of these decisions. And sometimes some of these yucky trade-offs that we have to make. I mean, I don't want to put steroids in anybody's face either, but sometimes that is the right choice to help a patient who is really, really miserable. And that was the impetus. So when I heard about this, when they explained to me there's a program in France that's really, really focused on pharmacists, I said, we could bring that to the US. I think we need it here, but maybe we could expand it too. And it could be expanded to a lot of the advanced practitioners like the nurse practitioners and physician assistants who are doing a tremendous job in taking care of so many patients in dermatology, but also even potentially making it open to primary care docs. Because again, pediatricians here care for a lot of these patients and carry a lot of that load. So that's been part of the journey in taking wonderful material that was already made for France and then kind of adapting it to a US audience has been really fun and really exciting. And I think that the final product is beautiful. They're to the point. They're very clinical, very practical modules that we really are proud of.
I think that's fantastic. And then, Professor, if you don't mind, could you, Peter, you so nicely talked about the role of pharmacists or perhaps, why it's so important. Is that part of the original inspiration to develop this too? What are the roles of the nurses and pharmacists in the patient pathway, Professor, if you don't mind answering that?
I think I share exactly the same ideas and Peter told us. Pharmacists have a key role in the management of AD patients. But the problem of nurses is that we have a lot of recent publication, demonstrating that finally the trained nurse are able to give an important role in the education of patients. And the patients and the family appreciate to see nurses maybe after the consultation, the medical consultation, to explain some details and to also have practical demonstration of what they have to do, where they have to put the cream and so on. So I think the role of nurses is really important. Unfortunately, this position of nurses in terms of education is poorly recognized by the administration, French administration, and only few hospitals, few departments. We only have the possibility to try to work with nurses. But my personal experience was very positive, because when you see the patients and when you ask them a lot of some questions, and that at the end they say, okay, everything is okay. And finally, when you check your responses with the nurse, and finally they say, oh, this mother was not convinced to use corticosteroid because she is scared to use corticosteroid on the face of his child. So it's terrible, because finally it's an example that the doctor sometimes is not able to convince, convince the parents. And that is a real problem. And sometimes with more time or more listening coming from the nurse, they obtain a better result.
Yeah, thanks for giving us a little bit more of a background there. And perhaps a question for you then, Peter. There are other programs that will more generally talk about skin or maybe skin-focused education. What's unique about this program, and what kind of an impact do you think this will have?
I think there are a couple of things that make it stand out. Part of it is that the intended audience is a little bit different. So much of the work we do, we're trying to talk to dermatologists. And I think sometimes the language and the concepts that we're using are not always as friendly to people who aren't doing day-to-day focus on dermatology and skin-related issues. So I think we start at a much more broad place for all learners, because again, some pharmacists are probably extremely well versed, but others, maybe they don't think about this much at all. And when we realize that a lot of the medications we're talking about are pretty new, just within the last couple of years, there's a ton to discuss and a ton of things to cover. So we're talking about that to a broader audience. We're really thinking about sort of the impact on the patient and their family, and a little bit more about the big picture than I think we would for a normal kind of just here's an update on the pathophysiology or here's an update on the drugs. And then I think we're doing it from different perspectives, which I think is fun as well. We have different stakeholders speaking and talking about it. So you really get a much more varied opinion than if I just give a webinar. I think I can do a pretty good job, but it's only from my perspective. And by having different stakeholders actually give the lectures and contribute, I think it really adds new perspectives, which opens it up more broadly.
I think that's great. And then turning back to you, Professor. So then, this program seems to have really been thoughtfully developed. What do you think would be the impact of this program on the participants who take it? And how do you see care changing?
Yes, I think it's really important to assess the efficacy of such program. And the evaluation of this e-learning program was made 1 year after finally the first presentation was made, and each e-learning session, we follow the pharmacist during a period of 9 months. And finally, we ask some questions via online questionnaire. And on the 1,500 and so and 30 registration, the median atopic dermatitis knowledge score before the training, which was then 13, improved significantly after each modules, around 16.7, and persisted after 9 months of follow-up at more than 16. So we really demonstrated that it's a positive impact on the knowledge, and that is an important point for us.
I think that's actually really interesting that you have that data, because, obviously right after a program, people will gain knowledge, but for it to persist for 9 months, That's fantastic, because I think at that point it's become a habit for them, hopefully. How often do the pharmacists, maybe you can answer this for France, and I know Peter just talked about in the US, how much of an impact do the pharmacists have in determining that care or the level of comfort that a patient has with their treatment? Is it significant?
I think in France, especially with the young generation of pharmacists, amongst students or also practitioners, and I think we have a lot of people who are able to detect non-adherence to treatment. And that is the reason why we need to help them, to give them some tools, and if they can find into this e-learning some material which help them to convince and to learn the patients how to better manage the disease.
And then how long has the program been going on? Since 2018, is that correct?
Yes.
It's been 5 years now.
Yes.
Have we hit the 5-year anniversary? Is it time for a party?
No, but I think we could think about that. We keep in touch with pharmacists, but we also try to train these other French-speaking countries, in Algeria, for example, and also in Quebec, in Canada. And we obtained, it was a different design because it was only 1 day and a half training. So finally, my feeling is the replay is the best way to propose such webinar, because it's the best way for the pharmacists to find by themselves the good time for them when they have time to take 1 hour to speak, to discuss, and to understand more about atopic dermatitis. I think it's important because finally, at the beginning, we had 3 possibilities. Directly online, also on the site, the presence of the session, and finally, 90% of users use this replay presentation.
Yeah, I mean, I think having it online is so exciting because it's so much more easy to access.
Yes, sure.
And then, Peter, maybe you can speak to this because, we've been talking about pharmacists, but you touched on all the other people that really could benefit from this who probably don't get atopic derm education. So, Peter, can you speak a little bit more to that specifically? And I see that there's 4 very nice modules: basics of eczema, skincare and topicals, systemic therapy, and quality of life, which are all, to me, really is a comprehensive way of succinctly addressing atopic derm. So can you talk about who else would benefit besides pharmacists for this?
We would love for lots of people to check this out. So I even think dermatologists who are well-versed in treating atopic dermatitis might enjoy it because they're really crisp. They're very, like I say, very efficient sections where we update people on sort of the newest findings and try to bring everything together from different perspectives. But certainly pharmacists, I'd love for pharmacists to learn from this and, hopefully be brought up to speed, and hopefully it will reinforce a lot of what they know, but maybe add some new things. Advanced practice practitioners like nurse practitioners and physician assistants, physician associates would be amazing if they would look at it. And I even think pediatricians and primary care physicians, this is a really quick, up-to-date, very well-vetted way to get a lot of information that is currently coming out at the rate of a fire hose, right? It's just so many new things, but we've really tried to distill it down to the most important pieces, put it all together, and really make it so that for a clinician practicing, they say, okay, these are the big take-home points in a very, very short period of time.
Okay, I think this is really exciting. I mean, the modules are well put together, super easy to get through, and as you said, very high yield. So I think this brings us to the question, how do people register? How do they take this training? I know a lot of us are probably on the go. Probably we can listen to this while we're on the go if you don't have to be at a set place, right? Because it's online. So Peter, can you speak to how can people register and how easy is it to access the program?
Absolutely. So it is a free program. You can register online. We'll put all that information in the notes so people can just click and go right to it. And you can set it at your own pace. It is there on demand. I will tell you that while the visuals are really good, it is definitely something you could keep listening to on your headphones. If you're walking out and about, and if you're doing your housework, you can listen to it in the background because I think a lot of it is audio. So while it's not designed as a true podcast, I know I myself do that with many video things. Sometimes you're just watching the speaker's face and you're like, oh, I still want to keep listening, but I'm going to go ahead and sweep or clean up the dinner plates or drive home from work. And this way you don't have to keep looking down, but we'll put all of that information in the notes for folks.
Fantastic. And then finally, just as we're wrapping up here, I want everyone listening to realize that this is a program that's just been, I think, a labor of understanding that we need better education. It's a labor of love, but it's also done really well. So please do go check it out. Professor, do you have any last thoughts about this or any overarching things that you want people to know about this program or like your passion behind it?
I'm really interested in the US experience because for the first time, the healthcare provider from different horizons, can upgrade their knowledge about atopic dermatitis. But moreover, they can also participate in real time, in the real life, participate in the management of patients. Everybody at his level, the nurse level, at the dietitian level, psychologist level, or pharmacist level. So I think it's very important. We didn't do that before. And I think we are really excited to follow your experience in the US and how you will be able to extend the large target of people concerned by the management of atopic dermatitis patients.
Thank you very much. And I just want to take the time to thank both of you for coming on and really talking about this very innovative and very easy to access program. Thank you, Professor.
Super. Thank you so much.
I think we all know that eczema is so difficult to treat. It's difficult for the patient who's suffering. It's difficult for the family. It's difficult for society. It's even difficult for the clinician. And I love this quote from L. Duncan Bulkley. This is from 1881. So a long time ago, this has been known as one of the toughest things to treat. The quote is, "Eczema has been rightly called the keystone of dermatology, and he who fully masters its management is not only skilled in regard to treating one of the most common and distressing of all cutaneous diseases, but has acquired a knowledge of the principles of dermatologic practice which will assist in the treatment of many, if not all, other maladies of the skin," unquote. And I just love that because it really shows us that to be good at treating this condition, to understand it and its impact on patients and families, I think makes us better. It makes us better to treat anything else and to deal with patients and people from all different areas. And that's part of what draws me to it over and over.
Hey listeners, we want to share some great news with you. Over the last year, we have been reviewing and redesigning the successful Integrative Skin Health series. Newly named Dermatology, Clinical and Integrative Essentials, or DCIE, a team of incredible integrative dermatology experts have been working on a new and improved curriculum focused on common patient questions and concerns. We're excited to launch the new DCIE program on January 1st, 2024. And right now, through November 30th, you can save $200 off the regular price when you sign up during our pre-sale. But that's not all. You also get immediate access to the original program, the Integrative Skin Health series. So it's like getting two programs in one.
You know, what's really great about this program is that it's geared towards PAs, NPs, MDs, and other healthcare professionals who are new to the profession or seasoned veterans because, evidence-based integrative approaches are still emerging for all of us.